It is recommended that the pump be cleaned after each feeding set use to prevent bacterial contamination of the pump. Further, failure to clean the pump can interfere with the function of the pump rotor, which can increase the occurrence of errors and warning alarms. Always clean and/or disinfect the pump after each use when these devices are used for multiple patients. This is to prevent spreading bacteria, viruses, and other germs between patients that interact with the same pump. Directions for cleaning the pump housing. Clean the outside surface with a damp cloth or sponge. For difficult to clean areas, it is permissible to wash the pump under running water. Avoid submerging the pump or washing with high-pressure nozzles. Directions for cleaning the power adapter. Unless soiling is observed, the power adapter should not be cleaned. If cleaning is necessary, unplug from the outlet and wipe the exterior surfaces of the wall plug with a cloth dampened with isopropyl alcohol.